Milwaukee's mask advisory set to expire at the end of the month. Is it the right time to roll back restrictions? Joining us, Dr. Jeff Pothof, UW Health's Chief Quality Officer. Dr. Pothof, Milwaukee's mandate, it's in effect until March 1st, and to be honest, there's no real teeth to the mandate, so varying compliance across the city since no one's really cracking down. Schools, yes. Some restaurants I've been in, no. With COVID numbers in a free fall, is it time for the mandate just to go away?
You know, Ben, it could be. I think as cases continue to drop, we see a lower percent positive tests. We see lower cases per 100,000. These mask mandates, these things we do to keep ourselves safe when cases are very high, can be allowed to expire. It's possible by March 1st we'll be in a position where that's okay.
The mandate may go away. Should we still put the mask on when we go in the grocery store?
Yeah, you might not have to. I think if you're unvaccinated, the propensity to get really sick from COVID, there is still COVID out there. If I was unvaccinated, I'd be masked. If I'm vaccinated and I'm boosted and I know cases are really low, I think you can leave the mask off. I mean, it's hard to say that after so long, but it would make sense.
I know I had to do a follow-up because it was weird hearing it come out of your mouth. I just want to make sure I heard you right. Dr. Pothof, for all the parents out there with young kids, and this includes me, because I've got questions about this, what's the deal with the Pfizer vaccine for kids under 5? The brakes got slammed. What's going on there?
This is confusing. So if we back up to when Pfizer first tried to do the trial for the 6-month to 4-year-old vaccine, it was a 10-fold reduction in dose, and they wanted to do a 2-dose series. Now, they forecasted at the end of last year that they weren't seeing the efficacy that they wanted. They're going to increase it to 3 doses. They never really gave that efficacy number out there. As Omicron surged, the FDA said, hey, why don't you just submit that 2-dose data because maybe something's better than nothing. And then Omicron started to fall away. I think they saw that efficacy data and said, that's not that great. And I think what you'll see now is that 6-month to 4-year-old dose series will be three shots. And that's likely to get approved in April, which is curious because it's about the same timing as Moderna should have their study available. And they didn't reduce the dose that much. They might be a 2-dose series. That'll give parents a choice.
So just to be clear, I mean, it seems that it wasn't they were afraid it wasn't working at all, but they just didn't have enough data. They're just waiting for more data to come in, basically.
Yeah, I think, when Omicron cases were out of control, they probably thought, some efficacy is better than none. The safety hasn't really ever been a problem with this. And now with Omicron falling off and maybe that efficacy being lower than they thought it was going to be, they're like, you know what, let's just make this a 3-shot series rather than do 2 and then 2 weeks later say, hey, you got to get a 3rd. That would be confusing too.
For kids who are eligible, this is becoming a tough decision for parents now because they're hearing the numbers are dropping. But it is people 18 and under that's the highest percentage of people still getting COVID, but they're less seriously ill when they do come down with it. So what are you telling parents right now about if your kid needs to be vaccinated or not?
Yeah, I really encourage parents to get their kids vaccinated. At a population level, the disease is less serious, but for any individual kid, it could be a problem, whether they get really sick or whether they just have chronic fatigue or other issues. The other thing is as we look to remove mask mandates from schools and things like that, one of the variables you want to look at is what percent of those kids are vaccinated. And you want that number to be high. A lower percent kids vaccinated makes pulling back masking requirements in those cohorts a little bit trickier. So, still a really good idea to get your kids vaccinated.
Appreciate all the information you always give us, Dr. Pothof from UW Health.